I'm Marlene Bedrich. I'm a registered nurse and a certified diabetes educator. I'm the program coordinator for the Diabetes Teaching Center here at UCSF. I'm going to talk about three specific topics involved with diabetes management. Today, glucose monitoring will be the first. Then I'll talk about insulin delivery, and then we'll talk about ketone monitoring as the last topic. So we'll start with glucose monitoring. The objectives for this segment are: describe the steps to perform self-glucose monitoring, list three potential causes for inaccurate blood glucose meter readings, name two continuous glucose monitor devices available in the United States, and list three ways that CGM can be used in managing diabetes. There really are three ways that people can test their glucose levels at home. The first is urine dipstick testing, and I'm really not going to talk about that at all today because it's really not anything that people do anymore because we have much better ways of testing for blood glucose levels. So the blood glucose meters are advised for anyone who has diabetes so that they can manage their blood sugars and their diabetes. There are many different meters on the market. I will show you a smattering of what's out there in a few minutes, but really the meter that is chosen for each patient is mostly based on their insurance coverage. It's important that patients have clean hands when they test. So that means no fruit juice, no lotion, no residual alcohol, rubbing alcohol on their hands, no water. The next way that people can check their blood sugars is through continuous glucose monitoring devices. So here's how the continuous glucose monitors work. There is a small sensor, a small wire sensor that the user places under the skin every 5 to 6 days, depending on which model they're wearing. That wire contains a glucose oxidase, and when mixed with glucose and oxygen, it transmits a current that is sent wirelessly to the receiver. The person who is wearing that can now see what their glucose levels are trending. The sensor sits in interstitial fluid, so there is a little bit of a lag time that you would see when the blood sugars are rising rapidly or falling rapidly. But there have been some significant software upgrades over the past few years that has helped to eliminate that. But still, that lag prevents the FDA from approving these devices to be used alone. So finger sticks are still required when patients are using CGMs. So the wire works very much the same way. The technology behind it is much the same as what the blood sugar meters use. So there are three components of the CGM device. In this slide, you can see that thin wire, which is the sensor that goes underneath the skin. There are inserters that people will use, and they really are quite painless to insert. The transmitter then on this device snaps onto the top of the sensor. As you can see in this slide here, the reading then comes up onto the receiver and the patient sees that. This slide shows you the two different systems that are available in the United States. The one on the left is the Dexcom system, and the one on the right is the Medtronic system. So this is the transmitter itself and the receiver down here. This piece here is actually the patient's insulin pump, which we will talk about in the next segment. On this side, you see that this is the transmitter for the Medtronic system. So what patients get from wearing the Dexcom or the Medtronic CGM, this is a slide that shows you if they were doing finger sticks, the points in time and shows what their blood sugars are doing. And you can see on this slide that it really doesn't look too bad. There's a little fluctuation, but in general terms, they're running in target. If you look at the slide that shows everything that's happening in between, this is what the CGM captures. So you can see that they actually were running a little bit low. They went much higher than they realized. These they probably noticed because these are their blood sugar tests. but then they may have overcorrected a little bit and came back down again. So we get to see the trend in between the finger sticks. I'm going to show these two devices to you, and I'll show you an actual screen of what a patient would see and how the CGM can really be of good benefit to them. Most of the insurance companies will cover CGM for type 1s, and many will cover for type 2 as well. It is an expensive device, and the sensors add extra cost each month. But in terms of preventing hospitalizations, preventing hypoglycemia, A1Cs do improve on these devices, and without additional hypoglycemia, it really just brings patients more into the target ranges. So let's take a look at some of the meters, how to do a finger stick, and the CGM devices. So let's go ahead and look at some of these meters that are out there on the market. This is just a smattering of some of the different ones, some of the more common ones that patients use. But remember, there are actually many more than just these. It's important to know which meter your patient is using, because that can determine which prescription you're going to write for the test strips. Really, we determine which meter the patient is going to use based on their insurance coverage. Most insurance companies have a preferred meter on the plan that will provide the patient with a lower copayment. It's also important to know which lancet they're using, because different lancets will hold different lancet holders will hold a different lancet, so some won't fit. For example, this one goes with this. It would not fit in this one here. So it's important to know what patients are using so that we write the right prescriptions for them. So now I'm going to demonstrate how a patient would do a finger stick with a home blood glucose meter. And I'm going to use the One-Touch Vario IQ meter that I have here. So this is the meter itself. The test strip is going to go into that little slot there. This is the vial of test strips. It's important to look at the expiration date. Many patients you will find have test strips that are expired, and we very much discourage them from using them because they could provide inaccurate results. The test strips come in an airtight vial. It's important that patients keep them in that vial, because being exposed to the light and air can cause problems. This is the lancet holder that goes with this meter. The top just unscrews. This is the lancet that fits into this device. There's always a protective cap that's covering the needle that needs to come off. And then this cap just screws back on. On each lancing device these days, there is a dial that will dial how deep it's going to poke. So a large number means a deeper poke, a smaller number means it's going to poke lighter. And so the goal is to poke with the lightest stick, but to get enough of a sample to do the test without poking 2 or 3 times. So I'm going to put my test strip into the meter. All of the meters turn on when you put the test strip into it. So I tell patients, if you put the test strip in right, it will turn your meter on. And so you can see that on this screen, it shows you exactly what to do. It's time to put the sample onto the test strip. So I'm going to set the spring. I'm going to hold it tightly up against the side of my finger, and sides of fingers hurt less than the tips and the pads. So teach your patient to do on the side of the finger. You could also teach them to milk the finger before you lance it if they're having trouble getting a sample. So pulling some blood down into the tip of the finger, and then taking your lancet device and pressing the button. Small stick, didn't hurt. Little squeeze. The meters these days use much less blood. The blood actually kind of wicks into the test strip. And most meters these days in 5 seconds will give you a reading. So you see that my blood sugar right now is 115. The next important step, now taking this out will turn it off. The most important step is recording these numbers and using these numbers. And so it's really important to teach patients how to do this, what to do with the numbers, how to change their diet or their activity to change their numbers. So in this logbook, for example, you can see that there's a before breakfast, before lunch, before dinner, and bedtime. So I'm seeing that the blood sugar's looking okay, but then it's high at bedtime. That could be because of an extra big dinner, could be from snacking after. And when the bedtime number is high, the next morning is usually high as well. So this person learned from that. They probably saw high blood sugar, they went for a walk, they ate a lighter breakfast, their blood sugar came down, everything was fine. They did something different. They didn't eat such a big dinner. They changed up their snack. Their blood sugar going to bed was 142. The next morning it's 128. If I was going to write in my blood sugar here for before lunch, I would write the 115 into this square right here. So we encourage our patients to bring their blood sugar meter, their meter and all of their supplies with them to each of their appointments so that we can take a look at their equipment, what their blood sugars have been running, make sure their test strips are not expired, and that we can ask them then if they need new prescriptions. So that concludes blood sugar monitoring with a blood glucose meter. All right, so now let's look at the continuous glucose monitoring systems. As I mentioned, there are two devices on the market in the United States. One is the Medtronic system. It's the Guardian and looks like that. It can be a standalone or it can be integrated into the Medtronic insulin pump. This is the device that is used to insert the sensor under the skin. And this is the transmitter in its charger that actually is attached to the sensor and sits on the patient's skin, transmits wirelessly to the screen on the Medtronic system. Next, we're going to look at the Dexcom system. This is what it looks like. And it is inserted with a device that looks like this. The sensor is set underneath the skin. The needle that inserts the little wire comes back up into the housing and is taken off. The transmitter then sends signals to this screen. So if we look at the screen, you'll see what the patients can see. And what you'll see at the top is what the blood sugar level right now is and what the rate of change is, whether that number is going up or going down. You can also look back over time, over the last few hours, and here you see that this is a person who's actually having a low blood sugar, but it's running quite flat right now. They did have a high and perhaps they overcorrected and then their blood sugar got too low. And this again shows someone's trend over the last several hours, and right now it has leveled off. So what patients can do with the CGM is not only look at what the trend is and what direction their blood sugar is running in, but how quickly it's changing. They can also set alarms so that they can set an alarm to a low level and to a high level. And that way, if their blood sugar starts to drift too low, they find out about it and can treat it. Same thing if the blood sugar is running too high, they're busy in their day. This is just a system that just gives them a warning that maybe they should be looking at things and doing a finger stick to confirm and maybe taking some action. And that is our continuous glucose monitoring systems. So we have two systems. We have finger stick glucose meters that is widely used, and we have continuous glucose monitoring systems that some people like to use as well as an adjunct to the finger sticks.